we just realized that tomorrow the Opposition Day motion will be on the toxic overdose crisis. We welcome that, in that I think that it's very important that we get the facts out in order to dispel the misguided ideological-driven policies of the Conservatives, and it is really important that Canadians understand how difficult it is to save lives in the face of the toxic drug supply, and how important it is that we use all the tools at our disposal. And particularly, I think that we want people to understand that Mr. Poilievre has said that he would defund the safe consumption sites, which since 2017 have reversed 46,000 overdoses. And I also welcome today the fact that Mom Stop the Harm, one of the most, I think, impressive organizations of families who have lost a loved one to an overdose, have invited Mr. Poilievre to meet with him on June 1st, and we hope that he, like some of his Conservative colleagues, will be persuaded of their misguided approach once they hear from Mom Stop the Harm.
Bien, merci. Je vais rajouter à ce que ma collègue Mme Bennett vient de dire, c'est qu'il est important, même s'il est difficile de sauver des vies dans nos communautés qui sont affectées par la crise des opioïdes. Et moi, je pense non seulement aux vies des gens qui sont sauvés par les sites de consommation supervisée, mais aussi par les travailleurs. Moi, j'ai dans ma circonscription des organismes communautaires qui travaillent très fort dans la basse ville de Québec, entre autres, je pense au projet Lune, à la clinique SAPSA, à Interzone, des travailleurs de rue, des travailleurs sociaux, des infirmières qui, à tous les jours, travaillent dans des conditions extrêmement difficiles et qui se font dire par des politiciens malheureusement mal informés que leur travail n'est pas bon et n'est pas important. Donc, ça nous trouble beaucoup. Évidemment, on aura l'occasion de discuter de tout ça demain lors de la journée d'opposition, mais il faut absolument éviter qu'une morale crue et cruelle mette en jeu des vies partout au pays, avec ce qu'on a entendu hier et ce qu'on malheureusement risque d'entendre à nouveau aujourd'hui.
Mr. Bennett, is the federal government aware that in certain cases, safe supply is actually sold on the streets to purchase other drugs, and what's your response to that?
We have always known that diversion is a small problem, but it's a very, I think, a manageable problem compared to the lives that are being saved by the people using the safe supply. I think both the Canadian Medical Association Journal last year and the article this year is showing really how the overdoses are reduced, how people going to the street for tainted drugs is reduced, and lives are saved. So it is, we know that there has been an issue with diversion, but we really do believe that safe supply is a evidence-based approach to saving lives.
Is it the least bad solution in that case to provide drugs to people that are a bit safer than what they would consume on the streets?
Well, I think as the advisor to Stephen Harper, Ben Perrin, has said, what you're doing is you're substituting a safe supply to people who are dependent, such that they don't have to go to the street for the poison supply that is killing people. And I think that we have even seen with the study from Kalela Lalem, the Indigenous clinic in the downtown east side, that again, if you add the support of elders and knowledge keepers, that people go even less to the toxic drug supply. We also know that if you think of somebody who's been an injured worker, someone who's fallen off a roof and ends up on medication, and then gets cut off their meds, such that they then go to the street for their drugs. Those people are dying. And so the stereotype of the downtown east side, which is obviously a huge challenge for everyone trying to help, is misguided when you think of all the people that are using alone and dying alone because of that the supply is so poisoned.
What is the evidence, Minister, that diversion is a small problem? Because we're seeing media reports of reporters able to find within a half an hour wide supply of the safe supply for sale on the street.
Well, right now the BC Centre for Substance Use is following from the decrim beginning of the Section 56 exemption, that they are following all of those things in terms of the public safety, plus the public health indicators, so that we can track over these next 3 years what is going on. It is hugely important, I think, to understand that the people using Dilaudid or the hydromorphone have been known to be able to even share it with their family and friends, which is a safe supply. And so we are tracking that. But compared to the number of lives that are saved, that this is something that we will address. But right now, with the toxicity of the drug supply, we have to do everything we can to save lives, and that's what we're doing.
Yesterday, things got pretty intense around this issue. The Conservatives, you can see them across the aisle, basically saying that you guys, this policy is killing people. What is your response to that, and how did that make you feel getting such an accusation like that yesterday, that you're killing people?
Well, firstly, safe supply, that BC Coroner's been very clear that there's no evidence that safe supply is implicated in the deaths because of the toxic drug supply. And they've made that clear in every report. So it makes me totally annoyed and appalled that people are using substances and their deaths in some sort of political trope of the failed policies that had gone on when harm reduction was removed from Canadian drug policy under the Harper government. And so this is again, I want to counter that with the 46,000 overdoses that have been reversed in safe consumption sites, and ask Mr. Poilievre, what would he say to the families of the loved ones that would have died if that approach was not available to their loved ones who do use drugs.
Do you realistically think that another meeting is going to change Mr. Poilievre's mind on this issue?
Well, I think that I think when you read Ben Perrin, I think that he felt that the Mom Stop the Harm really did change his mind on these things. That when you listen to the people who have lost a loved one and really how they want everything to be done to change the story. When you think that a lot of them lost their loved ones because they worked in construction, or they had it on, a different, got cut off their meds. That this is I think those are the people that people have to listen to. That not the stereotypes, and not the people who are actually, using drugs for political gain. When I think of my patients that use drugs, when I think of how they end up dependent on drugs, if people would look at Dope Sick and find out what happened in that movie in terms of what really was on the basis of investigative journalism, that you actually know that people don't want to get addicted. They want to numb the pain. And whether that's numbing the pain of adverse childhood events, or rape, or falling off a roof, these people didn't want to be addicted. They just can't. They are trying to avoid being dope sick, which is how painful it is to come down off these drugs.
We need to go to QP. Thank you so much.